Hi, and welcome to the Navigating Neurodiversity podcast. I'm Vivien, registered psychologist, and today we'll be talking about visual processing. So I've invited Mr. Andy Teo. Andy is a developmental optometrist, and he has a master's in clinical optometry, and he's also a board-certified fellow in vision therapy. So I will put a link in Andy's website down below, and you can view his full bio. So thank you very much, Andy, for joining us today to talk about this topic that I'm sure you're very familiar with. But to start off, I'll ask Andy to first share with us more about his background and what got you interested in this field of developmental optometry.
Thank you, Vivien. I think I have to start off by saying that I got really interested in this because I started running a preschool in 2009. So as an optometrist, optometrists usually do your glasses, contact lenses and all that in a regular shop. But there is a subspecialty in optometry where we call it developmental optometry, where the developmental optometrists are interested in the science of how our eyes move and how our visual system understand what we see, or like what I would call learning related visual processes. Yeah. So that's how I got interested, because I was always curious why some children, have a hard time learning in school, and some have it relatively easy.
I see. So you started a preschool, you observed children having vision issues, and then you decided to go and pursue your master's. And this was in the US, in Pennsylvania, right?
Actually, in fact, I did my master's before I started the school. But I went for further learning, did my fellowship with the College of Vision Development. So it's like, in a nutshell, it's like you become a certified fellow in providing vision therapy. So the work that we learn from this sub-specialization is that we think about the learning related visual processes like visual motor, how the eyes move. It explains why children may possibly be careless, skip words, skip lines when they read, therefore affecting reading comprehension, etc.
Yes. Okay. So maybe we start with some definitions, because I think most of our viewers, parents, are familiar with like vision checks, right? The school health service nurses will go into schools, and then you have the Snellen chart and then see whether your child can read those letters and so on. So maybe, Andy, you can share, with us, what is visual processing? Like, how is it different from those eye checks? Yeah.
Thank you. So it's a very good question, because it's one that I get asked 100 times all the time from the parents. Because if your child has taken the Snellen chart and he can see clearly, right? The general assumption is that there is no vision problem. Okay? That is the general assumption. Now I'm going to dive a little bit, give you a little bit more insight. Well, first of all, even if the child sees clearly, they may have eye tracking problems, such as common symptoms would show like, skipping words and lines, difficulties copying from the board, because the eyes do not move accurately. So even if you have perfect eyesight, if your eyes do not move accurately, that would hinder your efficiency during learning. And then we have other movements skills such as eye teaming, where both eyes actually need to look at a single point accurately and comfortably with good sustained stamina. We think about that, like stamina in your eye teaming, so that you can do your homework, your exam comfortably across that 2 hours or 3 hours. Yeah, these are like two of the common visual motor, and we, haven't touched on like the visual perception. Like, can you understand why, or how you see, or a child is seeing? Can they understand what they see? Things like B and D. Why are they, getting letter reverses? In our terminology, we think that this is a weakness with laterality. So before you put your pen onto the paper, and the child is thinking, okay, this D, is this circle going this side? Or this circle is going the other side, right? There's no fluency with the visual thinking. We think it in that manner. And therefore, of course, it's going to cause difficulties, especially in spelling. Yeah.
Yeah, that's right. That's right. So among psychologists, I mean, we often see letter reversals and so on, and so when it occurs when the child is quite young in the preschool years, generally we say that it's not a cause for concern unless it's very persistent, so even when the child enters primary one, continues to show. Would that be the same for your field as well, that when it occurs in the early years, then it's probably not a cause for concern?
Well, I think when the child is still getting, receiving, like learning, alphabets and all that, if they can start from 4 or 5, you are going to get some weakness with the perceptual skills because they are still learning. But I think in Singapore, I would say a relatively fair age to be concerned is that by the end of primary one, and they are still making letter reverses, it's going to affect, writing sentences and doing very short composition and all that, spelling definitely, right? So that's going to pull down their learning process. So most parents who come to us who typically try to seek intervention during primary one or sometimes primary 2.
Yes. So earlier, Andy, you mentioned some signs that parents might look out for. You talked about the skipping of lines and words and things like that. What are some other signs that you think, they could look out for? So your child may have passed the Snellen, the vision check, but maybe showing some other signs that could indicate some visual processing issues.
Okay, the very common symptoms where it probably shows that the visual system is not processing well. We have the skipping words and lines. We have difficulties with copying from the board or taking a long time to copy from the board. Okay, there are other symptoms which you need to dig a little deeper or observe your child a little bit more. Is that they cannot stay on a near task for too long. There's seemingly discomfort whenever they do reading or doing their homework. Okay, if they tell you the words move, or they split into 2, double or swim around, okay, that is highly likely an eye-teaming problem. If they have some kind of visual discomfort in a very bright room, okay, there are some other conditions that are not only motor, they are like perceptual, they're highly sensitized, or like in my own term, they are allergic to certain lighting. Okay, this also can cause weak visual processes because it's uncomfortable looking at the text in those rooms.
Sure. So if your child complains of any discomfort or eye fatigue and so on, I think, some parents may think that, oh, my child just doesn't want to do homework and things like, which could be true in some instances. But when in doubt, it's good to rule out if they actually see signs of fatigue and discomfort in the child, right?
I think you're absolutely right. I think if a child is really trying very hard, but is still struggling, definitely it will be a cause for concern for further action.
Yeah. So maybe tell us a bit more about, your kind of the vision assessment that you do. Because I think, again, in Singapore, a lot of us are very familiar with, going to an optometrist, maybe fitting of glasses, and they have got their own equipment as well, looking at acuity and so on. So maybe tell us about how is it different with your vision assessment?
Yes. In a typical optometry setting, most of the shops will be doing glasses. In our practice, we don't do that so much, but we still have glasses because some of these conditions can be assisted with special glasses. We call our assessments as learning-related visual processing assessment. Broadly speaking, there are 2 types of assessment. You have the visual motor and there's the visual perception. Right. So the learning-related visual motor assessment is more like we want to know why is the child having like very poor efficiency during learning, or they are seemingly careless, or they struggle with learning. Classic hallmarks are just like what we just explained, right? And then this setting is done in a room that has both the standard optometry setting, we still need to check the eye power, because there are some hidden stuff like long-sightedness that kids with long-sightedness, they pass the standard eye screening with no problem at all. So it may be masquerading as a simple case with long-sightedness. We have machines that does infrared eye tracking to know how is the fluency of this eye movement, eye teaming machines, and eye focusing checks and all that. So these are all movement in the visual system. Even your eye focusing, because they are facilitated by the ciliary muscles. Now, the full assessment in such a setting would be about 1.5 hours, where we churn out about a 3 to 4 page report, where we also send to our referring referral parties like psychologists, sometimes occupational therapists, educators, or doctors as well. Yeah, so it depends on where the symptoms are coming from, and then we will work on the appropriate assessment.
Sure. And we'll talk about treatment as well later on. So what do you do about some of these conditions? But I thought I wanted to ask you about, that position statement, because I think a lot of psychologists and probably you yourself will be familiar. So I think in 2009, there was this joint statement called the Learning Disabilities, Dyslexia and Vision Statement. And they had all the big organizations within, like American Academy of Pediatrics, American Academy of Ophthalmology. So within the statement, I think they kind of reiterated that dyslexia is a language-based disorder, which I think, we can agree with. So they said that, the causes of learning disabilities are multifactorial, and vision problems can interfere with learning, right? So they agreed that vision problems can interfere with the process of learning. However, they are not the primary cause of dyslexia or learning disabilities. And then there was, a bit about the scientific evidence not supporting some of these, for example, tinted filters, eye exercises, or vision therapy for improving learning disabilities like dyslexia. Yeah. So I wanted to get your thoughts on that statement.
Thank you so much for the question. I think this is a statement that has been, it's not the first one. There are quite a few big guys are called providing statements and all that. But I have to say, well, first, the visual system is an area that is very vast. You have optometrists that are studying vision science. You have eye doctors that are studying the structure and the health, the physiological science in eye disease and all that. You have even psychologists in UK. They talk about visual perception, even about the light sensitivity. So first of all, I will first have to explain, it's a big subject, that visual processes is vast. Not any one party that I would say can hold have what I would call a complete picture about visual processes. Okay, so it sometimes gets a bit confusing. I will concur that parents sometimes also read this and then they say, "Hey, vision therapy doesn't seemingly holds a lot of evidence, nor is it supported by the associations, like the American Ophthalmologist Association or even the Pediatrics Association." Right, but I would say that we have to let me come back a little bit to this, because everybody's perception. Now, I'm not talking about visual perception anymore. I'm talking about their own perception of what visual processes can be different, right? If you go to an eye doctor, you're looking at the health of your eye. Sometimes our parents also go there because they went there before they came to us. Okay, there's nothing wrong with that. Well, firstly, we always got to rule out, if there's any disease in the eye. And the doctors will tell most of the time, more often than not, that the eye is healthy. There shouldn't be any reading problem. There shouldn't be any, eye movement problem because the eyes can move.
Yeah.
Now, when you come to us, it's a slightly different proposition because we are asking or we are going into the system, we're looking for questions, like, and answers, like, why is the child skipping words and lines? Is it because the fluency is not there, the accuracy is not there, and therefore they skip words and lines? These are what we are looking for. And for sure, the eyes can move, but it doesn't move accurately or fast enough to be efficient in learning. So think about this, like coming to our setting, is more a place that is doing visual performance that relates to learning. Okay, of course, we also do a simple screening to check if there are significant eye diseases, because this needs to be sent to the eye doctors for intervention. We are not the right professionals for treatment in terms of, if your eye has a cataract or glaucoma, they needs to be referred out, right? So coming back to the statement in itself, okay, because visual processors is vast, okay, I'm going to just quote you like, because evidence is something that is always building and it usually takes a long time. If you know, typical research can run from 3 years, 6 years, or 10 years even. So I just quote you like, even in a very well-respected Cochrane research, that for certain conditions like convergence insufficiency, there are very good evidence in the medical research that in-office vision therapy is the gold standard for providing relief for this condition. Think about it like motor physiotherapy to move the eyes better. All right. So because you can improve that, then therefore learning becomes easier, right? I also like to say that while the association may have its own views, because they may come from a select group of professionals like eye doctors, or I think even some optometrists don't really understand us very well because it's a different field. But I would like to say is that there are certain very established organizations that are providing vision therapy. One of them is actually the Boston Children's Hospital, who is also working with Harvard Medical in terms of generating more vision science, vision therapy work. If you go check out the hospital, in fact, I think this is the best children's hospital in the US. And they also provide vision therapy because they have seen enough cases that have improvement across time in terms of improving the motoric ability. From what I've gathered from their website, they seem to be doing mainly visual motor work. That means eye tracking, eye teaming, and eye focusing. And then they will put a line that they say they work with educational therapists for the other, visual perception, which is also almost like what we try to emulate in our own practice. Correct. Sure. So there is there may be conflicting or different views all across, whoever you see or wherever you read. But my opinion is that if your eyes don't move well, you probably don't learn well, or you have some barriers to learning. Or rather, I would say if you have good visual processors, you can move your eyes well, and you can understand everything like what you see, especially Chinese, because Chinese is high perceptual demand task, right? Then you probably wouldn't have any significant learning difficulties, if that's what I'm going to say.
Sure. Yeah, thanks for that. So maybe just to summarize a little bit, correct me if I'm wrong. Visual processing is definitely important in learning, and I think the statement says that as well, right? It's a very, very vast field, and even though for children with dyslexia, that may not be the first line of intervention. So for example, for dyslexia, we will still look with the phonological processing, phonics-based interventions, and so on. So that is still I would say the key recommendation for most children. But I do see also some clients where, in addition to dyslexia, they are complaining of like visual fatigue. They have, they're seeing certain things, they're complaining of jumping words and things like that. And so for those children, there could be co-occurring visual processing issues as well that also needs to be taken into consideration. So I think it's not always an either or kind of thing. These things do overlap, and I think they all kind of feed into the process of learning. That be, yeah.
I totally concur
Okay.
with you. Because we do see a lot of children with dyslexia, ADHDs, and sometimes autism as well. Well, especially a condition called DCD.
Oh, yes.
Since dyspraxia, developmental coordination disorder, already tell you that fundamentally they have difficulty with moving.
Yes.
If we go to the research, a lot of them have. So it's not really what I would call treating dyslexia or treating ADHD or treating a DCD or autism. No, because we don't actually treat these conditions and then make these conditions go away. We don't. We only improve the visual motor processes so that they can do their learning more efficiently.
Yes,
right?
yes.
And then they can be a little bit more efficient, like increase 10, 20, 30%. Every kid is a bit different. So we are really looking for weak visual processes in children with these conditions, or rather claiming that we fix that. That will be totally wrong statement, even though sometimes we see in some colleagues in some countries, even our association, the College of Vision Development, we do not support such statement. We have to stay in our field, which is relevant to our work.
Yes, definitely. Yeah. You said something interesting earlier about DCD, right? So DCD is developmental coordination disorder. So previously known as dyspraxia, also known as dyspraxia. So we often think about that as like muscular coordination, muscles working together and so on. So we think about that as gross motor as well as fine motor skills. So what you're saying is that even the eye muscles are involved in DCD. Like you see children with DCD having problems coordinating their eye muscles, their eye muscular movement. Is that?
Absolutely. Very high percentage of them that has been diagnosed. To recap a little bit, visual motor, in our head, then we will think eye tracking, eye teaming, the coordination of two eyes to point together, is sometimes, they get a pass if they can do this. But the question is, how long can they do this? Okay, some kids will say, it start to blur or double here. Now the book is here. They're operating at 100% of their eye teaming capacity. Okay, so even if they do it here and you see the eye go out and then go in, yes, they can do it, but it seemingly doesn't hold. The amplitude of what we call the convergence is very low. Right. It is going to give them what I call low attention span, only at near. Now, that's a clear hallmark. It's not far and all that. Because far, you don't need to do eye teaming. Your eyes go straight. Then there's one more, and that happens inside your eye. Although most kids do not get lao hua, but there are some children with such a weak ciliary muscle, they just cannot give you the eye power that you need for near, right? So they similarly also again low attention span at near only.
Okay.
So those are the motoric part of the visual system.
Sure. Okay. So let's go into, we've covered the assessment part, what you do, and then some of the position statements as well. Let's go into the vision therapy part. Could you give us a sense of like what actually happens? Because, we know so many types of therapy, right? Speech therapy, occupational therapy, psychological therapy. So now we've got vision therapy. What does it look like? And, could you give us a sense of what goes on in vision therapy?
So generally, of course, we first have to know where's the weakness? Okay. So we also have a plan for the parents, So let's say if your child is at the 5th percentile in terms of eye tracking where we norm against children in the US, so we will usually suggest a 12-session vision therapy package that is in line with what our local authorities are suggesting. 12 sessions, So we have the baseline, and on the 12th session, we do a review, right? To see whether we improve, right? So of course, sometimes there's some improvement or no improvement. It depends because multifactorial, multiple factors come into play, self-motivation, etc. Okay, so just to give you an idea, like this is how, briefly in a nutshell, how I will explain to parents like what they should see and all that. Of course, then we list down the problems: eye teaming, eye focusing, eye tracking, and all that. So they come into our office, like a weekly training session, and they will be doing a lot of eye tracking tasks, which will be slowly scaffolded. I think pretty similar to what most other therapists are doing, starting from the activities where the child can do, of course, still providing some challenge which they can successfully clear, and then slowly scaffold into higher levels of difficulties. Of course, all these activities, we do want them to, succeed, get it into the system, and then they can replicate similar performance in the classroom setting. Like, I increased my eye teaming amplitudes, my convergence, my sustenance, my stamina, so that I can look at the words longer without it becoming double. Of course, some of the cases where they start off on a very more severe setting, maybe they don't see double for 10 minutes, whereas compared to the past, they see it after 30 seconds, for example. But we will slowly, so-called like push and increase the level of difficulty. It goes on and on and on until we hit a level where we find that it seems to have very little returns on the training, right? We don't typically put, because one of the questions is parents will always ask, because sometimes, like, for example, speech therapy is quite long, right? Because some of the kids with dyspraxia, they also have speech delay, right?
Because they work
Or
on
they do
different
oral
speech
motor
goals,
and all that. Go on for 2 years, 3 years. Then one of the key questions that I always get is, how long is vision therapy going to be, right? I think it's a fair question because there's so many things to consider, right? You have education, work, and all that. So generally, most of our cases finish in 6 to 9 months. 6 to 9 months. There are some other cases that may take a year or slightly over a year, but they don't typically just have a learning problem. There's some other problem like brain injury and all that. Our work generally, we usually hit a level where they've improved to a certain level where we think they have possibly reached the cap in terms of getting the performance up there. Like reach a plateau.
Right.
It's like trying to learn badminton, where your goal is not to become a world-class national player, but just to play well enough. Maybe 6 months to 9 months is a good time for you to do that, because correct. We typically get the results in 6 to 9 months.
Okay, so you assess the improvement. You said there'll be pre and post testing. So that's a quantitative, as in you get some scores lah. Do you also get the qualitative feedback from the child as to how's reading? Is it getting easier? So you also get the qualitative
from our symptoms checklist. So every time they come in, they take the second round, every 12 weeks they take.
Okay.
So we also need to see
progress monitoring over time.
Because sometimes I'm not sure, because we have objective data like, the eye tracking machine seems to say you move better. Right? But the kid may say, the symptoms are still there. But sometimes if you ask enough, yes, I still see double, but in the past it was 30 seconds, now it's 10 minutes later that I get double vision. But they will still take it because they have it. So these are generally how we would assess. Sometimes we see improvement in the grades directly if they don't have a need for educational therapy, where it is more like difficulties reading, or expand it a bit, difficulties having comfortable vision reading, and not reading difficulties like dyslexia, then they will move. Why is it sometimes that cases do vision therapy, they didn't get a lot of
return on investment,
like improvement in terms of learning? Is because in learning, because I'm also a part educator, I have some diploma in learning. Because learning is not just moving the eyes. You have to understand what you see. Then the tutor or your educational therapist teach you from your current ability, and then slowly bring you up to your current school level. Okay, that process still needs to take place. So moving your eyes fast enough, just moving your eyes well and fast enough, but still cannot understand or cannot comprehend the current learning for their year, is still not going to give them the full growth that they require.
Absolutely, So it really depends on, I think we need to understand the child's needs holistically, what the issues are. And vision therapy might be helpful in addressing the vision efficiency part of things, right? But it's not going to teach the child higher order skills like comprehension, language skills and things like that. So those will have to be tackled separately, right? Okay, so thanks, Andy. You talked about the clinic sessions, how it looks like going into, so you'll be doing exercises with the child. Are these computerized, or are there a variety, like could be computerized, could be tabletop activities?
Well, it depends on what level they are. Okay, to explain it in the broader sense is that most of the time they will get to the computer work. They will get to the computer work at some time. We do typically use it quite a bit in office because some of the medical device, they are run on the computer and, projected onto the TV, because it gives us a progress evaluation, like how much are they changing every session they come in, right? But a lot of the activities are still done in free space. And this is such a good question because there are so many tech companies now that are doing vision training stuff on the computer. They do the online assessment. They use VR to do the training. And sometimes we get this question as well. Does your office own this equipment or that? So they had been drawn in to vision training because of the equipment that is online on Google and then on YouTube and all that. It looks like a very impressive equipment. But my own opinion is, the equipment cannot make a good diagnosis. And sometimes, you still need a practitioner that understand what's going on with the child, right? Rather than just getting the computer and then just start to do it. Because sometimes, like for example, a condition is called convergence excess. You don't have what we call insufficient convergence, but rather you have excess. But the computer programs give you a standard program where you train your convergence, whereas your convergence is excess, we shouldn't be training it. It's over converging.
Okay.
Almost becoming to the point of having a screen at near. Okay, it's opposite of convergence insufficiency. Though there are a lot more cases, like 80% more convergence insufficiency rather than convergence excess. But having the computer just do the training itself may or may not get you the result.
So you still need to do the proper diagnostics to identify what the problem is to ensure.
Absolutely. Actually, even the VR machine, you actually, a long time ago, I was a consultancy for a VR machine company, not for therapy. The lenses they need to put inside is probably like a 1000 degrees to 1300 or 400 degrees, because they got to project an image here, where some of these children have a vestibular problem, motion sickness and all that. Using those lenses or the VR machine right at the start is not something that I would advise. In fact, the VR machine is actually our level 2 or 3 work. Like they almost are going to graduate, then it comes in. But people are coming in asking if this can be the thing that you use first. Because it looks
cool,
impressive.
and fun, yeah. Right. Okay, so we've talked about in-office treatment. Maybe you could also share with parents, are there simple things that they could do at home that would be helpful? And then after that, maybe teachers as well in the classroom, what are some accommodations that would be helpful for children who has got visual processing difficulties? Yeah, maybe we start with parents first.
Okay, so let's talk about this because visual processors is quite vast. We will talk about visual motor Okay. So, okay, if the child has difficulties and is exhibiting skipping words and lines, then the regular accommodation that I will ask, like, yeah, I will ask the parent to help the child is sometimes just get the child to point at the words, because when you put your hand on the word, it helps the eyes to move better. It's extra kinesthetic and tactile input in addition to the visual motor, right? So it's like, of course, that will also mean that it's a compensatory system where the visual motor is not efficient. Therefore, I need to put my hand and I need to roll with my hand, right? But at least it is going to be helpful for them to complete the task efficiently, at least. The other thing that I would usually get into our assessment report is if they have a significant weakness, we request and kindly ask the school if they can make the words a little bit bigger, like a font size, child for the older, 12 to 14 for the older kids. And then because primary 1 and 2 typically they have one line and the words are quite big, so generally they don't really have a problem. And if you, I do not know if this is in your experience, learning problems seems to manifest more in primary 3 and 4 when the words become smaller also.
So when the words become smaller, I mean, we think about it more as like academic demands also go up as well. But
yeah, correct. So that's what my thinking. Yeah. Then the other stuff will be more like let the eyes take a break after 20 minutes, look far. Just let the child relax a bit. Of course, these are all compensatory strategies and all that. And if the children have a certain thing like what we call a light sensitivity, we ask the parent, in fact, some of them will be using table light. We'll ask them to take out the table light because it provides more stress. It's giving the child more stress. Or if their home is on the very, very white and bright setting, we ask, if you wish to change the light and all that. It's quite unlikely you can change this in school, but at least if you know it, you can do something at home. There are quite a number of cases where they use the table light without knowing. So after they take away the table light, it seems to be easier because the kid also do not know, because the parent is saying, this light is healthier for your eyes and all that. But everyone have what I call a different visual system or neurodiverse brains.
So sounds like a lot of these are environmental modifications that you can make to provide more comfort and to reduce the demands of a child. But in terms of treatment, really improving the function, the visual function and so on, that has to be done in office at present. Would you say that?
Well, first of all, we need to have a significant disorder. Then we will do such a recommendation. Generally, like they are on the below average setting on the standard deviation, like below 16 percentile, if I remember correctly. Other things that I will usually get a lot of parents to do is do more sports. Sports make your eyes move also. And it's fun. And it makes the whole body move. Right? Your hand gripping a racket is actually also training your eye-hand coordination. You're building power in your handwriting, right? You're crawling, all this little kids gym. I'll just get the parents, go sign up for it, if your kid is 5 and all that. Because I think something that is a little bit neglected nowadays is that in general, people don't move much, not only children. People don't move so much. There are devices, more time on devices, less time on the exercise, movement, games outdoor and all that.
Yeah, absolutely. I mean, I have parents asking me also because their kids are playing a lot of video games, and it seems like, a lot of these video games, like, I don't know, COD, where the multi-person shooter games, actually there's a lot of eye movement tracking and so on, a reaction time and things like that. Are there any studies showing that these video games could actually help because the child is like, practicing those very fast responses and being able to track multiple stimuli on the screen?
This is a very good question. I haven't actually seen such a study yet. But there are a lot of therapy games that are coming out. Well, even we are also developing one. We want to make it more fun than the existing one that we have. But of course, we don't do it as a shooter game. We do it like some other way where we're trying to make it where children can play together, have some fun together, and then something can happen if they do it fast enough. Their runner in the race will run faster, something like that.
Oh, yes, kind of like
A
the
bit like
feedback kind of.
yeah, correct. You work hard, you get a reward.
Yes.
That kind of thing. Yeah.
Okay, nice. Yeah. How about in school? Are there others, that you would like to add on that maybe teachers could do? You talk about the bright lights in the classroom. I actually come across a classroom rather, where they kind of put something over it because the child had autism and was getting, very
Sensory
sensitized.
overload.
Yes. So they actually put like a little, I think it was a piece of cloth or something to cover it up. So I guess that could be any other accommodations that you know of that teachers could do that might be helpful in the
Well,
classroom.
I think because when you work in a classroom setting, it depends on who is there, which children. I mean, is it does the class have children with all sensory overload or just some, right? So there is a so when you ask me this question, this is a good question, you see, right? Because let's say there's only 5% with a sensory overload, whereas there's other 95%. Changing the light also wouldn't fit the equation very well for the other children, because the science is also clear that you need white light for improved attention, right? So light is very interesting. On one hand, on one group, maybe I have sensory overload. This white light to me, give me stress. This white light for you increases your attention.
I see.
If you put on the orange light, everybody will feel sleepy and all that. But this one kid will have okay.
Yeah.
So this is
tough.
such a good question, and it's so difficult, right? So sometimes I tell the parents is that, you can't change the whole environment for you, but I can make you a pair of glasses so that you can use during your exam. Or sometimes they get reading glasses for the exam.
I see.
Okay, even though they may not like the child to be over reliant on it, but I say, think of this as a tool that can help you improve efficiency for that 2-hour exam. Then it is really up to you whether you decide you wish to do it or not do it, because you can't change the whole environment, to your child. And most of the time, more often than not, the parents would go ahead.
Right.
Yeah.
Thanks so much, Andy. Maybe one last question. I wanted to ask you about the tinted filters because, earlier we were having a chat about it. And as a psychologist, when I was training and then looking at the position statements and everything, it sounded, I guess, not very scientific at that time, that just putting a different color tint over the paper would miraculously help the child to be able to read. It didn't sound very right. But I wanted to get your thoughts on that, because I wonder if, maybe it certainly will not help the child to be able to read, but perhaps visual comfort, those things might come into play as well. What has been your experience around tinted lenses, and do you use them?
Very good question. Also, this question I get asked from many professionals all the time. Now, in the market, you probably have heard of a thing called Erlen syndrome,
lenses,
where they use Erlen lenses. There's some other brands, like in UK, you have the Cerium lenses. There may be some other places. It's like there are a few brands, okay? And this is my own opinion, okay? These things are there to regulate the light coming in. That means either less light or more of a certain light, because the brain is having what I call a sensory overload, or having an allergic response to that light, that frequency or that wavelength. All right. So these things are there to do something. Then the question is, Does everyone have it? Okay? Or do all the children with dyslexia have it? Now, a straightforward answer I can give you is no. Not all the children have it. Okay? But rather ask the question of, does the children have, in optometry we call it visual stress or pattern glare. Okay, pattern glare, we use it mainly for post-brain concussion. It's more like, they didn't have it, but it's because they get, it's quiet, Visual stress is like more like they get it from, earlier years and all that. So it doesn't treat any of the conditions that we mentioned so far, like dyslexia. In fact, to an extent, it also doesn't treat visual stress. It doesn't treat, I'm not going to talk about other syndrome because I can't find, I cannot represent them in their position, right? But it certainly can provide relief, to sufferers who have this condition. So typically looking at a black text on a white background, high contrast sensitivity environment would trigger a very reactive response in the brain, a hypersensitive reaction. So giving those thin dials down the reaction, the sensitivity, and therefore giving them more comfort for the learning, for the tutoring, for the exam, for the educational therapy. So these things, does it treat anything? So the word treatment is something that have to be used very carefully. It doesn't treat. It is a compensatory device to help the individual be more comfortable when they read.
Sure,
right?
sure. Similar to earlier when you talked about vision tracking, right? Then pointing is not going to treat the vision tracking, but it supports, it helps to accommodate that difficulty.
Correct.
Yeah.
So another question is that I get often is, wow, since Erlen has thin, these other guys have thin, generally I'm talking about the non-developmental optometrist professionals. How is it different from getting the tins at our place, right? So from what I understand, practitioners that do the tins only, who are not optometrists, they cannot check the eyes. So they will refer the case to the eye doctors or another practice, right? So then they will check the number and then they will order the tints for them. Usually quite expensive, I think, right? So how is that different from our practice? Because as an optometrist or developmental optometrist, we have the ability to put in other things like, if the sensitivity is only happening at near and not so much in the general environment, I'll just put you the tint, give you a near prescription. If you wear it, everything for blur is actually not clear for far. It is the best number for reading only and learning. Sometimes they need a little bit of a thing we call prisms because this visual stress condition tends not to exist by itself. It tends to come in with eye tracking disorders, eye teaming disorders. It's like a package of things together. I have not had a single case where they are just diagnosed with one visual stress. Never. They're always having eye focusing problem, eye teaming problem. It's like a whole package of things.
It's all interconnected as well, right?
So when we do the classes, we can do it as a progressive lens for the children, where they have difficulty doing a focusing shift for them, so to relieve their effort, or prisms, so that we can relieve them, to make it easier for them to do eye teaming and near. This is in addition to the thin. So, this is my own opinion. There's a lot more things that we can fit into a pair of glasses compared to practitioners that just prescribe a color. And there's a lot of consideration. Sometimes, I don't want to mention which group and all. If the colors are too dark, yes, it absolutely relieves the visual stress condition. But when it's almost like a half a sunglass, when you do your reading, you can't read also. I cannot comment so much because sometimes I see them as really quite dark. I do not know about you. Have you seen some of them wearing it? It's so dark. So when we test this, we have to be very careful, even with the children's response.
Right, okay. So it sounds like it's important to really have a holistic view of the eye functions and so on,
Correct.
and not be too narrow, like, oh, I'm just giving lenses to target this area, because
Correct.
that might actually affect the other area, the domains of visual
Absolutely.
processing as well.
Yeah.
Thank you so much, Andy, for sharing all your experience and the knowledge in this area. And thank you for your time as
You
well.
are welcome.
So I hope that, it's been helpful for our viewers also. If you've got any additional questions for Andy, please feel free to comment down in the comment section below. Thank you for watching. Bye-bye.
Thank you.